My name is Ryan Glatt. I have a background in fitness. I've been in the fitness industry for a while. I don't know. I lost count. Anyway, I work at the Pacific Neuroscience Institute, which is a place in Santa Monica, California. We have a lot of different physicians. It started as neurosurgery, then primarily focused on brain tumors, actually, and brain cancers. So it was an integrative neurosurgery practice where it was an ENT, a neuro-oncologist, a neurosurgeon, and a neuro-ophthalmologist. And they developed this method of removing brain tumors in a minimally invasive way, sometimes without surgery, called a keyhole surgery, where they would go in through the eye and or the nose to remove a brain tumor. And then that was about maybe 12 years ago, I think it started, maybe a little bit more. And then about 8 to 9 years in, they wanted to open up to individuals with dementia and Alzheimer's and mild cognitive impairment and look at dementia prevention and Parkinson's disease and stroke. So it's really grown, and I was able to come on board about 8 years ago and start a medical fitness program that was focused on improving cognitive health. And so I run a thing called the Fit Brain Program, which is probably best described as a clinical arcade. So as a kid, I had a traumatic brain injury and was very overweight. And now I'm only slightly overweight. But as a kid, I lost weight off of a game called Dance Dance Revolution. Who's heard of Dance Dance Revolution? Yes. So I was born in 91, and so I'm still a big gamer. I had the PlayStation 2 home version of Dance Dance Revolution, and I played it like crazy. And I basically rehabilitated my concussion. I went from like a C student to a B student. Still not that great, but better than a C. And I was making friends. I started playing sports. I started rap battling. Don't make me do that this morning. So it like completely changed my life. It was amazing. And I didn't really know why. But as I studied the effects of exercise in the brain later in my exercise science career, I started to understand why. And there's actually decades of research on Dance Dance Revolution and the Nintendo Wii and other exer games, what we call them, to improve cognitive abilities and balance and weight loss and other things, and even academic performance in children. And it's been applied to people with Parkinson's, to those who have cancer. Like if we look at pediatric cancer or adult cancers, or adults with cancer, I should say, they actually provide these exer games as a way to motivate people to exercise when they're feeling very lethargic and amotivated. And so I basically created this place called a brain gym where we have medical fitness interventions geared towards brain health outcomes. It's mostly geared towards older adults, but we get a lot of people who are post breast cancer or brain tumors or various types of cancers as well. So my experience isn't really based in cancer, but I've ended up working with a lot of people with various diagnoses, both neurological and people who are just having cognitive issues due to breast cancer treatment or cancer treatment in general, the cancer itself. And we'll be talking more about that today. So my master's is in applied neuroscience. I'm just finishing up my PhD in health and human performance.
Press.
Have about 5 more people to recruit. Vanessa, if you don't mind muting yourself, I'm so sorry to call you out like that. Thank you. And I'm a medical exercise specialist and a board certified health coach. So, oh, and if you want to follow me on the gram, there's my handle. I don't know how many people do that, but I think that's cool. I'm trying to be relatable. Plus, I'll have my email and my Instagram handle again at the end. So if you do want to reach out to me for any questions or resources or research, or you're just very lonely like me and this is the only way you make friends on webinars, hit me up. All right. So, what is Chemobrain? I'm sure all of you have heard of Chemobrain, even if you're not really been in the profession that long. And I want to acknowledge that it's really, really cool what Dr. Wonders has started here. The fact that we can be fitness professionals or interested in being a fitness professional or allied healthcare and be really interested in helping people with and recovering from cancer is amazing. Um, and further that's what medical fitness is, and I think that's awesome. And I'm sure you're interested in a lot of different things related to cancer. And one of those things is Chemobrain. And Chemobrain is something that's a word that's thrown around a lot. I'd be surprised if you haven't heard of Chemobrain. And it sort of is a general term. It's not the clinical term. The clinical term is cancer-related cognitive impairment. Because chemobrain assumes that there's chemo, but chemo is not the only thing that can cause a cognitive impairment. There's a lot of things that can cause cognitive impairments, but cancer-related cognitive impairments, or CRCIs, the generalized term has been called chemobrain. And it's a term used to describe memory issues, thinking problems after cancer treatment, primarily in breast cancer survivors. However, it doesn't just happen after treatment. It can happen before, during, and after treatment, and for even many, many years after remission. So we're going to find out why that is and how this relates to kind of my normal day job, which is talking to people about dementia prevention and improving overall cognition. So a very common issue I see is women 65 or older who have had breast cancer treatment that just never quite felt the same after their treatment and are now worried about Alzheimer's or dementia or a mild cognitive impairment. And so we're going to talk about why that might be happening. And the things that we do for them are the same things we could be doing for our clients. And it isn't just, like I said, as the result of chemo, it could be the direct result of the cancer. It could be due to other symptoms like sleep issues or mood issues that then in turn cause thinking problems. And cognition is just a general term to describe thinking abilities like attention, memory, speed, executive functioning or organizing, impulse control. It could be a lot of different things. And it's very prevalent during treatment. Up to 75 people experience chemobrain, which we're really talking about CRCIs, during treatment, and 35% still feel it after treatment ends. And this is just for breast cancer. This isn't looking at the other types of cancers. So the question then is that 35% accurate? Because what happens is people underreport these cognitive symptoms because a lot of people don't know what's normal and what's abnormal. A lot of people are dismissed. Like, number one, we know that women are dismissed by healthcare much more than they should be. So that when someone is being treated for cancer and they bring up what seems to be unrelated side effects, or could be due to aging, or could be due to hormones, or could be due to stress, are often dismissed when they bring up this cancer-related cognitive impairment, especially when they don't have the words for it. Physicians aren't trained on it. Maybe there's not enough awareness around it. And so there's this like weird dismissal, and maybe also they don't know how to address it. And so I would say that 35% is probably much higher than research has found because of that. And also, the symptoms experienced are typically around memory. Most people know to identify memory as something that gets a little worse with age, but it may not be memory itself. And let me explain that. Someone might say, well, I have trouble memorizing names and faces now, but it could be because they're less focused. It could actually be because of memory, and we'll talk about certain memory centers that are affected by chemo and cancer processes. But it could be focus, could be attention, could be how quickly they make decisions, maybe making the wrong decision, maybe not making the decision to exercise. Maybe there's some amotivation or apathy involved in that on the mood side, and some processing speed changes. So there's all sorts of different symptoms that can be experienced including mood symptoms. And mood is not cognitive, but if we're talking about the brain as a whole, it includes mental health as well as cognitive health. And we know that's also a big issue, although we're not talking about mental health too much today. So, chemobrain is a real and common issue that's actually called cancer-related cognitive impairments, CRCIs, that could significantly impact a cancer survivor's cognitive abilities and daily functioning. And in my case, people with like a glioblastoma and a brain tumor, sometimes it's terminal and sometimes they've had a removal of a tumor. Um, they're still worried about cognition. And let me just say, even if they don't have cancer at all, if you're talking to their spouse or you're thinking about yourself, mental abilities are very important for us. And so this is something that I think as fitness professionals that we shouldn't just be thinking about range of motion. we should also be thinking about daily functioning. And as we're going to learn, exercise is one of the best things we can do for cognition. And if we are the pharmacist of this medication, we need to understand the dosages and understand why, and furthermore, be aware and educate our clients and patients about the benefits. All right, so let's talk about the causes of chemobrain or CRCIs. It could be the direct effects of cancer treatment, like chemotherapy, radiation, and medication, leading to cognitive changes. Inflammation and stress, particularly neuroinflammation. The body's inflammatory response and high stress levels during cancer can also contribute to those cognitive changes. Hormonal changes, especially for breast cancer survivors. But any level of hormonal changes, like I work with people with pituitary tumors, and there are a lot of cognitive changes that happen when your thyroid or your pituitary is not working the way it should. There's shifts in hormone levels, especially for breast cancer survivors. Um, Personal risk factors like age, genetics, and other aspects of brain health, pre-existing traumatic brain injuries, concussions, exposures to environmental toxins, ADD, ADHD symptoms, personality changes, mood changes before, during, and after treatment. And it's typically evaluated through a self-report, which means someone has to bring it up. Otherwise, the doctor or the team doesn't really know about it. And again, if they do bring it up and it's dismissed, kind of gets buried. If the family doesn't know to expect this or the patient doesn't know to expect this, it may never come up. How do you know someone has a mental or cognitive problem? It has to be through some sort of conversation. Not everyone just gets neuropsychological or cognitive testing just because. It's very extensive. You need the referral. It takes time. It's stressful to go through. So it's typically through some kind of self-report. Somebody needs to advocate for themselves and say something, which we know is not happening as much as it should. And then there's some questionnaires and I think there's been some psychometrically designed questionnaires where there's scores and things like that. But typically it's through self-report. But people often don't have the language to express how they are feeling. And so it behooves us to understand it so we can talk to them about it. Now, this is from an article that I'll show in a bit, but basically, this is all the different kind of mechanisms that can affect cancer-related cognitive impairment. In this case, the researchers called it chemotherapy-induced cognitive impairment, CICI. And in the gray boxes are compounds, medications, over-the-counter prescription or research-based medications that may and are being studied in addressing that. That is less important for us, but good to know. And so part of the CICIs can be apoptosis and autophagy, which is basically cell death, especially in the brain. There's epigenetic modifications in the brain. There's what's called these inflammatory cytokines. There's oxidative stress, the reduced presence or effectiveness or concentration of certain neurotransmitters like dopamine or norepinephrine. And then a loss of, if we think of a neuron or a brain cell, there's something called the dendrite, and there's a loss of the dendritic spine, and the brain cells are not branching as well. So think of a tree that's being pruned, and certain metabolic factors like MAPK dysregulation. So it's a little bit more of the science and different drugs and compounds. Like for example, if we look at the loss of dendritic spine and arborization, so memantine is something that we give to people who have Alzheimer's disease, and it's a medication that helps support certain neurotransmitters. And then vitamin D or atorvastatin. Atorvastatin's for high cholesterol. So there's also a really big interest in, and then we see like ibuprofen over here and different things that we might recognize, and then some things that we don't recognize, such as certain medications or genetic modifiers. So what's interesting is there's a really big area of repurposed drug use. And some of those repurposed drug uses drugs used for other conditions that are now being applied to certain types of cancers. It's a very big area of research. So that's a little bit about the science of Chemobrain, some definitions. Let me know in the chat if you have any questions about that. And I'm happy to pause and stop and answer those questions. Let's continue on though, if you while you think about any potential questions. Uh, Please mute yourself if you can, mostly to protect yourself from embarrassment. So just take a moment to check to make sure you're on mute. I do publicly shame people if something awkward happens, so you don't want that to happen to you. Um, Dr. Wonders asks, you might have missed it. Do these drugs cause chemo brain or help with it? That's a good question. So it depends on the person, it depends on the drug. And it is sometimes difficult to ascertain what is going on there. But if sometimes the drug is the replacement for chemo, right? And so I think that it can still be a side effect of certain drugs. But in that slide I showed, those are meant to help with aspects of chemo brain based on the mechanism. So these ones do not cause it. I mean, they certainly could, but like let's look at aspirin and ibuprofen. We know those are meant to reduce inflammation. So that would this paper specifically, which I can show you afterward, is specifically looking at drugs that can help some of these mechanisms. Yes, I know. All right, so let's talk about some evidence-based interventions. Exercise. Yes, this is where we come in. Aerobic and resistance training 2 to 3 times per week for 30 to 60 minutes. Okay, let's think about that for a second, because when we hear exercise recommendations that sound general, we typically don't pay attention to them. And we just know that aerobic exercise and resistance training are good for us. And then when we're working with individuals, we need to make sure that they're reaching the dosage of that. So if exercise is medicine and medicine has specific dosages, if you're like, yes, aspirin is good for you, I'm using a metaphor here, and I only give you like 25% of the recommended dose, it could still do something, but it's probably not going to be effective or as effective as intended. So it is true that any exercise is better than no exercise. But I want you to pay attention to the frequency, which is 2 to 3 times per week on average for 30 to 60 minutes. Now let's compare this to the 150 minutes of moderate intensity to vigorous intensity exercise per week or more, the physical activity guidelines for Americans second edition, which I know you all quote every day as you wake up in the morning. Um, if we do 60 minutes 3 times a week, how many minutes per is that per week? That's about 100, 180 minutes. If we do 30 minutes twice a week, that's only 60 minutes. So we can start with a minimum of twice a week for 30 minutes and work our way up for there. And I do believe there is more benefits from more exercise, but that exercise should be more varied and not just one type. So when people say, what is the best exercise for brain health? People usually say aerobic, but it's actually multimodal because different types of exercise do different things. And we're going to learn that a little bit more. Aerobic exercise creates blood flow and neurotransmitters and brain-derived neurotrophic factor. Resistance training, yes, helps build and maintain muscle mass and lean mass, but also releases certain growth factors and does things for certain brain regions that aerobic exercise does not. And then motor exercise, things that are coordinative, dance, yoga, Tai Chi, martial arts, boxing. Those things do things that aerobic and resistance doesn't because we're actively using our brain while we move. So all of that is important to consider. But something as little as aerobic exercise and resistance training, um, just 2 to 3 times a week, can significantly improve focus, working memory, and multitasking ability. And this is in those with cancer-related cognitive impairments. Brain training, specifically cognitive exercises and memory games, 1 to 2 times per week for 60 to 90 minutes, or 2 to 3 times a week for 30 minutes, which enhances attention, memory, and decision making. You may have heard of brain games like Lumosity or Brain HQ. I'll type in the chat, but the one that seems to have the most evidence is Brain HQ as in brain headquarters. It is an app or a website. It's not too expensive. It's maybe, I think, $15 a month. There's family plans. There's a good deal of research behind it. Not so much for CRCIs. There's not enough research for CRCIs in general, but a lot of people who have a CRCI who are interested in dementia prevention end up playing brain games in addition to exercise. And research shows that while these brain games may not transfer to real world skills, they can improve aspects of cognition and improve aspects of the brain that are related to processing speed and focus. And there's a psychological aspect of Chemobrain that I think a lot of people don't talk about, which is if you know you're experiencing a cognitive deficit, you sometimes make psychological compensations around that. So I have ADHD. If I'm not interested in something, I just won't pay attention to it sometimes. And so what brain training has done for me is taught me how to allocate my attention even when I don't want to for longer periods of time. And it was really more of a psychological thing. So even if it's a psychological training relative to the brain training, maybe you're less stressed when it comes to something mentally challenging. Maybe you learn to focus your attention longer. Maybe it's like exposure therapy. You're not as anxious about your brain because you're doing these mental challenges that are difficult on a regular basis. So brain training can be used for all sorts of different things like that. Then we have mind body practices, what we call mind body exercise or MBE. This can include things like meditation, mindfulness, Tai Chi, or Qigong, 1 to 2 times per week for 60 to 90 minutes. And even though it's a set of movement modalities that are slow, it actually helps with improving speed in the brain. Very interesting. And can also reduce this generalized brain fog that some people have. And then also there's some psychological and strategic based approaches like cognitive behavioral therapy, also known as CBT, typically done with a psychologist or a social worker or a mental health professional or counselor. There's even apps for CBT now. And they have to, CBT has to do with identifying unhelpful or negative thoughts and things like cognitive distortions. One might be, oh my gosh, I'm having these memory issues. I'm never going to get better. That's fortune telling. That's a type of CBT cognitive distortion called fortune telling, and what might be a more positive or realistic thought, right? So CBT is about identifying those cognitive distortions, which we all have about various different things, and basically talking about those. So weekly sessions for 6 to 8 weeks for 60 to 90 minutes each has been shown to improve recall, focus, organization, and confidence in daily thinking tasks. The memory strategies piece is a little different. Memory strategies are how to function when you're having a cognitive deficit. So, one very simple compensatory strategy for those that are disorganized could be managing a calendar. I know that sounds silly, but I think we've all felt more organized when we spend time managing our calendar or maybe even creating a to-do list that's prioritized, that's then scheduled, and we organize our mind. And so when people are experiencing thinking challenges, daily tasks are harder, and therefore these memory strategies can help. We'll return to those, but let's talk about exercise. Bit of an overwhelming chart, but this is the neurobiological effects of exercise from session, one session of exercise. This is from a big review study, and that basically duration, excuse me, of exercise lasted anywhere from 5 to 90 minutes, mostly aerobic, but could also be resistance. So what happened is let me get my laser pointer, should have done that earlier, for up to 15 minutes after stopping exercise. So we've done the exercise and we've stopped. This is what's happening in our brain for certain periods of time after we've stopped. For 15 minutes after, we have more activation of our prefrontal cortex, which is in our frontal lobe. That controls executive functions, impulse control, short-term memory, problem solving, and planning. From 30 minutes to about 2 hours, we're releasing increased elevations of the following neurotransmitters: GABA, lactate, glutamate, norepinephrine, dopamine, cortisol, and serotonin. And the following brain waves are all active because exercise, unless it's mind-body exercise, is typically excitatory. Delta, theta, alpha, and beta waves are all increased. We're releasing more of what's called brain-derived neurotrophic factor, which the author, Dr. John Rady, who wrote the book Spark, calls miracle grow for the brain. I wouldn't go as far as a miracle grow, but it is something that it's a compound that's been found in the brain to be mobilized and created as the result of exercise that can then facilitate brain health functionally and even structurally by creating new brain cells in certain parts of the brain, not all. And then for up to 2 hours, we're a little sharper because our prefrontal cortex dependent cognitive functioning is usually a little bit better. And for 3 hours after exercise, we have stress reduction. For 24 hours, we have better mood. This is after one session. If a medication could do this and we own the company to distribute this medication, we would be billionaires. Guess what? You are people who distribute this medication, and you're definitely not billionaires, but boy, is this stuff effective. So if, well, we pharmaceuticals can't replicate this. It's impossible. It's so multimodal and happening from so many different levels at different levels of the brain in biology and neurobiology. It's very complex. But most people undervalue exercise for doing this. And so when we actually learn about the benefits of exercise in the brain, it becomes a bit more urgent. Like, what the heck have I been doing not touting this information? And why don't people know this? And so when people say they're not as motivated to exercise, I'm assuming they haven't heard this yet. Because when they do and they have a problem, they're motivated. So a lot of behavior change comes from linking a problem to a solution. And not a lot of people see exercise as a solution for their CRCIs. This is, by the way, again, after one session of exercise, so this is acute. It's a short-term effect. So if we want it to stay or be longer lasting or more significant, we need to do it again and again for many weeks and months. Now let's talk about exercise and brain blood flow. There's something called angiogenesis. Angio means blood, and genesis means creation of. So when we exercise, that's the stimulus. This is typically aerobic exercise. And we increase cerebral blood flow. And by the way, that doesn't have to be aerobic, just anything that gets your heart rate above resting levels. We then increase the stimulus for what's called healthy angiogenesis. You have about 400 miles of blood vessels in the adult human brain. 400 miles. And so we create more connection between those blood vessels when we have more metabolic demands. And the vascular network is better connected, so the delivery of blood, oxygen, and nutrients is better. And this is what's called a neurovascular unit. This is a blood vessel and a neuron. And when we have more blood flow to a neuron, that oxygen, nutrients being delivered, it's going to be healthier as a cell structure. And so neurogenesis, the creation of new neurons, is more likely, but it's also protective and promotes growth factors and helps with survival. Neurogenesis is interesting because it's sort of heavily debated. We don't know if we create new brain cells in all parts of our brain, but there's two areas where we think we do, which is the hippocampus, the area of the brain responsible for memory, which we'll talk about, and the olfactory bulb responsible for smell. Now, cancer-related cognitive impairments might lead to apoptosis or neuron cell death. So we don't know really what parts of the brain that happens in because we're only looking at brain scans and not at individual neurons. But it's a theory that we have. So we're not really sure how and where we create new brain cells in the adult human brain because it turns out the way we figure this out is through brain dissection. And I've tried to do this, but it's very hard to have a client or a research participant run on the treadmill and then kill them and then dissect their brain. They just don't like it for some reason. So we typically do that with animals, and we can't translate all that animal evidence to humans. Anyway, these are the things I think about at night. Let's talk about recommendations for brain health, for exercise. This is the same type of recommendation I give to people who want to prevent dementia, who want to improve their motor and non-motor symptoms of Parkinson's disease, those recovering from a stroke. It's the same things for cancer-related cognitive impairments. Again, we're seeing this physical activity guidelines for Americans, second edition. You hate to see it over and over again, but there's a reason. There's a reason. It's because a bunch of nerds got together in a room over several years and keep finding that after some analyses, these are the minimum recommended dosages for this medication we call exercise. So 150 minutes to which means 2 hours and 30 minutes a week to 5 hours a week or 300 minutes of moderate to vigorous intensity aerobic exercise or equivalent. Now that doesn't mean exclusively aerobic. Okay, that can mean anything that gets your heart rate up contributes to those minutes. Walking does not contribute to those minutes unless it's aerobic in nature. This is the thing that most people have a hard time with. Moderate intensity. So we got to do that repeat, or sorry, rate of perceived exertion scale, RPE. I just do a 1 to 10. I don't do like the 5 to 17 crap because that's confusing even to me, even after all these years. But just 1 to 10, 10 being the most intense, 1 being the least intense. Walking is on average like a 3 to 4, unless you're doing brisk walking or walking up a hill or walking on a treadmill. And getting that to like a 5 to 7, that would be moderate. And so educating people on that's really important because if we don't get to a moderate, remember that blood flow and those 400 miles of blood vessels, we don't deliver enough oxygen and nutrients to those unless we also get our heart rate up. But resistance training or dance or table tennis even can get our heart rate up. And even in things like Tai Chi, there's been found to be metabolic benefits, even though that doesn't get our heart rate up. But still, we need some of that aerobic stimulus for all those cool downstream things that we already talked about. But there's additional benefits for neuromotor training. Again, that could include the mind body exercise like Tai Chi, Qigong, yoga, Pilates. And it can include things like skill based exercise like racket sports, dance, and martial arts. And of course, strength training. But multi-domain exercise programs slow the progression of cognitive decline more than any single type of exercise modality. So if someone's doing one type of exercise, you have options. Do you coach the frequency of how often they do it? Do you coach the duration? Do you coach the intensity? Or do you coach the variety? And I like to coach the variety because if we're going to a brain buffet and we want all these different benefits, we need these different types of exercise. So variety seems to be one of the things that is most important. And if we do more variety, we get more minutes. If we get more minutes, we sometimes usually get more intensity. Not always, but sometimes. And we are getting different types of stimulus to the brain and body. So I like to target variety because most people like to stick with one type. They go to the gym, they do the treadmill. They go to Pilates and they walk. And that's usually what I hear from my experience is there's a single modality and people need to do more. Even we fall into this. Like I do too much resistance, not too much resistance training. I'm not that jacked, but I don't do enough aerobic exercise is my point. So variety, coaching variety, I think is really important. We spoke about the hippocampus earlier. Here it is in red. It's deep in the middle of the brain. It's like this seahorse shaped structure, and it's next to the amygdala, and it's inside the temporal lobes. Um, the hippocampus is affected by aging, but also chemotherapy and cancer. It increases in structure and volume with aerobic exercise, although there's certain areas of this hippocampus that also respond to resistance training. It kind of responds to everything. So we find that the hippocampus is smaller or less active when people are sedentary, have sleep issues, chronic stress, chemotherapy, various disease states. But it improves in size when we sleep well, we exercise, we manage stress, and we treat various diseases. It also responds to general like walking and physical activity. And when we improve the area of the brain, this area of the brain through things like exercise, we also see improvements in memory. So many of the memory complaints that people have as the result of general aging or even cancer-related cognitive impairment could be due to the hippocampus changes. And that could be in size or it could be in function. So areas of the brain can change in size, not very significantly as we might think of like a muscle size maybe, but it can change in cortical thickness in millimeters. And we can evaluate that through an MRI, a structural MRI. And also, we can evaluate brain activity through things like quantitative EEG or functional near infrared spectroscopy or FNIRS. And usually, people get an MRI for various reasons, right? Maybe we get it with contrast to see if there's any brain tumors or brain bleeds. We might get a CT scan to look for brain bleeds. We might get an MRI to look at the size of the brain. And so when people are experiencing memory issues, a lot of the time the hippocampus is affected and it's very sensitive to lifestyle interventions, which is good news for us. Now, when individuals with cancer-related cognitive impairments do more than one type of exercise, in other words, multimodal, it's aerobic, it's strength, it's resistance, do we think that they get better than doing one type? I've already given you the answer. The answer is yes, but let's find out by how much. This isn't a comparative slide, but let's find out how much it helps certain aspects of cognition. So I believe this was meta-analysis. I have citations at the end, but there's improvements in cognitive function with multimodal exercise programs in those with cancer-related cognitive impairments in the following areas for about 12 weeks, I believe, to 6 months, so 3 to 6 months, about a 63% improvement in attention and focus, 58% improvement in processing speed, and 54% improvement in memory and recall. Again, at least 50% improvements in these aspects of cognition as the result of multimodal exercise. And you all aren't rich yet? What is going on? What is going on? So again, it's all in the messaging. It's all in the messaging. If you know this information, and I'll give you the citations at the end, because when we talk with doctors and people are skeptical, we should know, we should cite our sources. We're not just making this up here. That when we know the information that this can help, and a lot of people have this problem, you tell me if you should have a business problem. I don't think any of you should have a business problem because this is really incredible. So these are very remarkable effects. Of course, all science is limited to or has limitations, but this is really impressive. And this is just, from I believe it was an analysis study, but there could be issues in how they evaluated it. There could be issues in, long-term follow-up. And, research is like having parents that are really tough on you with grades. It's never enough. We always need more research, right? But this is very impressive, and we should be touting this information. Now let's talk about mind-body exercise. The frequency seems to be about 1 to 2 times a week for 6 to 12 weeks for 60 to 90 minutes per session. The types include meditation, mindfulness, Tai Chi, and Qigong. And yes, meditation isn't really a mind-body exercise, but it is an adjacent therapy or intervention that's helpful. And it's good for feeling mentally sharper, reducing brain fog, and even improving speed and focus. And so this is important because it really addresses the stress management side of cognitive issues that people have as part of CRCIs and can really help with just helping to improve brain activity, even if they're not chronically stressed. So a lot of people say, I don't need to meditate. I don't have a problem. Like, you don't need a problem in order to meditate. It is a brain activity enhancing intervention. 72% of people in a study with cancer-related cognitive impairments improve their speed of processing doing mind-body exercise. That's crazy. Usually we don't see that in other interventions studying mind-body exercise. We don't see this much improvement in processing speed. So it really kind of lends some interesting theories. How much of this is psychological? And do not say it's all in people's heads, but there are psychological contributions to cancer-related cognitive impairments. How much of it is neuroinflammatory or due to the cytokines, the HPA axis, heck, even the gut-brain relationship? There's a lot of mechanisms here whereby relaxation and stress reduction can help speed that much. That is very interesting. And here is some research on brain training. We talked about brain HQ. Cognitive training, such as those with computer-based memory and thinking exercises, can improve attention, memory, and decision making. They're typically done 1 to 2 times per week or more for at least 12 weeks, with sessions lasting 60 to 90 minutes. And about 75 people who participate in cognitive training with CRCIs notice meaningful improvements in how their brain feels and functions. Even if that doesn't transfer to real daily life and they're using the ATM or finances more effectively or they're driving better, that is okay because even if they just feel better, that's worth it. And giving someone to do something on their own when they're not with you or a therapist is also very empowering. And so that's why I really like computerized cognitive training. If the interest is to prevent dementia, which I shared with you a lot of my clients, that's their core goal. I can't imagine any of your clients want dementia, even if they're not thinking about it right now. The most evidence-based interventions for dementia prevention in healthy older adults, but I would also translate to those with mild cognitive impairment, are multi-domain lifestyle interventions, with the largest effect sizes seen when combining physical exercise and cognitive training. Yes, simultaneously, which we can talk about dual tasking, which is what I do, but mostly they're doing 150 minutes of exercise at a moderate intensity or greater per week, and they're doing anywhere from 2 to 3 times a week or more of cognitive training on the computer. And they're trying to sleep better, and they're changing their diet, and they're working with their doctor. The more things that we do, the compounded benefits are increased. Now let's talk about CBT and memory tools, particularly the psychological approaches. So if we're going to recommend someone goes to a CBT therapist, we can better understand what is the dosage in which these things help. And sometimes neuropsychologists or psychologists that are trained in cognitive impairment will teach these psychological memory tools that are compensating, meaning how to memorize names and faces better, how to manage a calendar, how to manage a to-do list. It's like organizing your life in a boot camp, right? The frequency is 6 to 8 weeks, 60 to 90 minutes. It usually includes talking through challenges and learning strategies like planners, reminders, routines. And benefits include improved ability to remember things, better focus and organization, and confidence in daily thinking tasks. And outcomes include moderate improvements, especially how people feel about their brain health. So if you didn't have a calendar, how would you feel about your brain health and the stress in your life? Probably not very good, right? So if you took away my calendar, I would become insane, I think. My life would implode. I would feel very unorganized and I would feel very stressed about that. Many people are going about day-to-day life, especially if they're retired and they're not working and they no longer have that external accountability or pressure, do not organize their life. And that's okay. We shouldn't shame them about that. But maybe this is why people have a hard time with behavior change and quote unquote don't do what we tell them to, right? So should we be upset that people didn't exercise and did their black and white photocopy 1990s handout of exercises? Or should we think, maybe there's some psychological cognitive challenges. How can I help with that? So a great behavior change strategy for exercises, can we schedule that exercise? Can we do it in a group class? Can we do it in a training session? So there's external accountability. There's a whole host of different strategies, but it's important to note that that person might have a hard time executing behaviors and remembering what to do. So we can't just say it to people as if they are an AI and they're like, yes, I understand. I will execute behavior. That's not how human behavior change works. In fact, people without cancer-related cognitive impairments, like me, have this problem. We all have something that we should be doing that we don't do enough of, right? So have some empathy for the people you work with that they are going through this psychologically. So are we. A lot of people are doing this, but especially those with cognitive impairment. This is a little outside our scope of practice, but it's very much outside our scope of practice, but it's within the knowledge for us to know about. So I want to be very careful about that. We're talking about medications and supplements. You are not allowed to recommend or even suggest something, but it's for us to understand if we suggest that maybe our client speaks with their doctor about talking to a psychiatrist or an oncologist about their cognitive symptoms. Here are some of the things that could be used. Stimulants like modafinil might help people short term. It might be recommended, but they're not widely recommended because they're kind of a short term fix. Certain dementia drugs like memantine or donepezil, only in specific use cases where the mechanism calls for it, but it's not typical chemobrain. It's usually used for things like brain radiation or brain tumors. And then there's things like I won't even call them a natural remedy, but supplements like ginkgo biloba, omega 3s, um, curcumin, not a lot of strong evidence. Now, it depends on the supplement. And earlier on a slide, we saw things like vitamin D and maybe even vitamin B and different forms of vitamin B, which can have neurological effects. And I'll admit, I haven't taken a deep dive, and so I'm not dismissing all supplements. But given that supplements are widely unregulated and we just don't have enough evidence, we're not really sure. So there are more medications that are being researched. There are things that could help, but it depends on the type of cancer and the mechanism and many other factors. There can be negative interactions with medications. And so there's kind of a movement right now to sort of like distrust science and Western medicine and like just go self-solve with the Dr. Google, Dr. AI approach. But we have to be very cautious about that for various reasons. So medications are not the first choice for addressing the cognitive challenges of Chemobrain. This should really be more lifestyle focused. So fitness intervention professionals should focus on non-drug options that are shown to be more effective. And it's interesting that we have a lot of these lifestyle interventions like mind-body exercise and multimodal exercise and cognitive training that have been shown to be really effective, but people are talking about medication supplements more. It should be the opposite. So we should be talking about the things that have the most evidence first and then prioritizing based on level of evidence. But unfortunately, we don't live in that world. So here's what you can do. Include aerobic and strength exercises regularly with those who are cancer survivors and those going through cancer treatment based on their ability to manage that. Um, Encourage mental exercises, puzzles, apps, games, things like Brain HQ. Recommend mindfulness or incorporate movement meditation or Tai Chi or Qigong or yoga or have them take a class in those things. Collaborate with other providers, such as mental health professionals to provide cognitive behavioral therapy or memory strategies. And you could even non-clinically, non-formally track the client's feedback on, hey, how you feeling cognitively? How's your attention? How's your memory? And you can use that to guide progress as well. So in summary, chemobrain or cancer-related cognitive impairments is real. And again, 75% of survivors experience this and 35% of it still feel it. I would argue that's more, especially when we throw in age-related changes. Exercise and brain activities and cognitive training all help improve thinking and memory abilities. Small, consistent actions add up. So regular, manageable sessions of exercise, brain games, and mindfulness can lead to meaningful gains. We had a lot of kind of random dosages of like 1 to 3 times a week and 2 to 3 times a week and 60 to 90 minutes. That's kind of overwhelming. Just to summarize it, if you're wondering how often you should do something, it's usually 2 to 3 times a week for an hour. But there's not 9 hours, 9 days in the week where we can do that. But it might take 10 to 20 hours of focused effort of interventions to aggressively address this. That's a lot. That's a lot. So how can we make that easier? What if we did 30 minutes of exercise followed by 30 minutes of brain training? And then separately, we have an appointment with a therapist. Okay, that's a little bit more reasonable. 1 hour a day, 3 to 5 times a week. You do your 30 minutes of exercise followed by 30 minutes of brain training, move on with your day. That's feasible. What about Monday, Wednesday, Friday? We do aerobic. Tuesday, Thursday, we do strength training. And then off days, we do Tai Chi. That's an example. Maybe we do a variation of that. So this is where the coaching aspect comes in, and we can make things a bit more accessible depending on where people are at. So we can incorporate exercises and be aware of the effects of those exercises on brain health. And we can even market ourselves as being able to address something like this based on the evidence. And we should be, I'm gonna give you my email. You can steal this presentation, give this presentation, and market your services. I'm cool with that. If you're educating the community about this and clinicians and allied healthcare providers and survivors or those with cancer, I think all the better. I'm not advertising, but if you are interested in learning more about brain health and exercise, and even how to do dual task exercises like giving people a mental task while exercising, what we call dual tasking, I do have a course called the Brain Health Trainer course. It is an online asynchronous 10-hour course. However, I'm not suggesting it, and I'm going to tell you why. If you do want that information, I would highly recommend going through the ACE Senior Fitness Specialist course, which is the same price as my course, but includes two courses and gives you CECs, which my course does not. I only manage my course separately because I've had a few different distributors. It's a long story. We don't have time for it. But if you do want that information, I highly recommend going towards the senior fitness specialist through ACE because you get like a bunch of CECs that are equivalent to 20 hours. You become a senior fitness specialist, but half of the course is my course. So the first half is coaching senior fitness, and the second half is the brain health trainer course. So if you're going to do that, if you want that information, this information, I would strongly recommend going through the ACE Senior Fitness Specialist because it's a better deal and you actually get CECs for it. You will not be labeled as a brain health trainer, but you will be able to say you've completed that curriculum and you will be a certified senior fitness specialist. So that's fun. All right. So here is my email. Here is my Instagram handle. Follow me. I am exceptionally lonely. I would love to hear from you. Um, Slide into the DMs, as you say. Send me an email, and I will send a PDF of these slides to Dr. Wonders to distribute. And I am mostly approachable. So if you have any questions, I am happy to answer those questions. Speaking of which, I've ignored a couple questions. Let's answer those now. Zach says, I know you mentioned hormonal changes can cause chemobrain. What if a patient is on a hormone blocker, specifically a breast cancer patient on an estrogen hormone blocker, and has not had any chemotherapy? Can that stop? Oh, it's Ashley, but you're under Zach. Good brain game, Ashley. Okay, so yes, I can't speak specifically. I'm obviously not an endocrinologist, but I will say without cancer at all, or chemobrain, or cancer-related cognitive impairments, changes in hormones affect cognition, full stop. Which ones and how much, I have no idea. But changes, like we work with a lot of women, two-thirds of Alzheimer's cases are women. Many of the women we work with have also had breast cancer. And so we can't really, like, sometimes we can't look at doing HRT, which might improve their cognition, but might increase their cancer risk. Right? So you got to weigh the risks there, and it's very challenging to navigate that, right? Um, so if they're on an estrogen hormone blocker, yes, they could still have cognitive issues, and we may not be able to differentiate like how much or if the hormones contributed to it, but it's definitely possible. So I hope that answers your question. Um, what are my thoughts on creatine and brain health? Yeah, it's interesting because when you really dig into the evidence, there's some interesting evidence, but still not enough, in my opinion. Um, and I want to know like a little bit more how much are the brain benefits of creatine from resistance training rather than the creatine? And I'm going to say, based on the volume of evidence, that the resistance training helps more than the creatine. I'm not anti-creatine, but there's definitely more hype than there is research. Specifically for cancer-related cognitive impairments, I don't know. I haven't looked into that. I'm definitely like pro things like omega-3s and anti-inflammatory stuff and all that, but I haven't looked into it for CRCIs, but I'd be happy to. Any other questions? All right. Dr. Wonders, I think it's time for you to wrap up and go to the beach.
Well, thank you so much. That was very, very interesting. And, I mean, not only just for the chemo brain side of things, but I have a long history of dementia and Alzheimer's in my family. And just thinking about how I might be able to be a little bit proactive with my brain health. I mean, I don't think that this was information that was around when, my parents and grandparents were younger. So thank you so much
Right.
for the work that you do, and I just think this is so interesting.
Thank you. It's my pleasure. And I think when we contextualize it like that, like we're all interested in brain health
Hmm.
for
Yeah.
one reason or another. It could have been learning disabilities that we have had or have, or maybe our kids, or maybe we have dementia, Alzheimer's in the family. And like there's many different
Hmm.
risk factors that affect that. And
Hmm.
all these things I presented on today are relevant to that. There's certain things like going to see a neurologist and getting your eyes and ears checked and talking about sleep, which we could have talked about more. So there's much more to talk about, but a lot of the things that I'm talking about for this presentation are very much the same for Parkinson's or MCI or Alzheimer's and dementia prevention. So, or even those living with Alzheimer's. So there's a lot of similarities among those things. So I think when we're talking about brain health, everyone can glean something for either
Mm,
themselves or who they're working with.
yeah, I agree. Well, thank you so much. This was so interesting. And I know you're getting up early your time. So
I'm
even
actually
double
awake
thank you for
now.
that.
I Yeah, halfway through I started to wake up when I finished my cold brew and I realized what I was and then I got excited. So I'm good.
Very good. Well, luckily everyone else stayed awake too, which is an accomplishment, you know.
Yes.
So,
Good job, everybody.
all right, everyone, thanks so much for joining us. Enjoy the rest of your day. Bye.